Have you ever wondered what a small root can do for your health? Ginger, with its bold flavor, hides a true arsenal of benefits that go far beyond cooking. From improving digestion to fighting inflammation, this root has been used for centuries, and modern science is beginning to uncover its secrets. Want to know how ginger can transform your life? Stay with me in this video and discover the incredible powers of this super root. Oh, and don't forget to subscribe to the channel if you enjoy this video. 1. Anti-inflammatory properties. Ginger possesses strong anti-inflammatory potential due to the presence of gingerol, an active compound that plays a crucial role in inhibiting pro-inflammatory enzymes and chemicals. Chronic inflammation is the root cause of various degenerative diseases such as heart disease, type 2 diabetes, arthritis, and even cancer. Immune cells, in response to negative stimuli, produce chemicals called cytokines that aggravate inflammation. The gingerol in ginger directly modulates these cytokines, blocking their production and, consequently, reducing inflammation. For people with chronic conditions like rheumatoid arthritis, where inflammation is constant and destructive, regular consumption of ginger can significantly reduce joint pain and swelling, improving mobility and quality of life. Moreover, ginger's anti-inflammatory effects can also help reduce silent inflammation that often precedes heart disease and metabolic syndrome, helping prevent larger complications in the long term. 2. Nausea relief. Ginger is one of the most widely used natural remedies for relieving nausea and vomiting, especially in contexts like motion sickness, morning sickness in pregnant women, and postoperative nausea. The mechanism by which ginger alleviates nausea involves its direct action on the central nervous system, specifically on serotonin receptors responsible for the vomiting reflex. By inhibiting these receptors, ginger prevents the triggering of the nausea reflex. Scientific studies suggest that ginger can be as effective as conventional antiemetic drugs, but without the side effects of drowsiness or sedation. During pregnancy, ginger is widely recommended by doctors as a safe alternative, as 1 to 1.5 grams daily can reduce episodes of nausea by up to 80%. It is also commonly used among chemotherapy patients, helping to alleviate intense nausea episodes, making the treatment more tolerable. 3. Improves digestion. Ginger is well known for its ability to aid digestion. It works by stimulating the production of gastric juices and digestive enzymes, which are essential for breaking down and absorbing nutrients. Often, discomfort after a meal is related to slow digestion and the retention of food in the stomach, a condition called dyspepsia. Ginger speeds up the process of gastric emptying, ensuring that food is moved into the intestines more efficiently. Additionally, it relaxes the muscles of the digestive tract, helping to prevent cramps and bloating. In people with chronic digestive disorders, such as irritable bowel syndrome, IBS, ginger can reduce intestinal spasms and alleviate gas, promoting smoother digestion. Research also indicates that ginger may act against pathogenic intestinal bacteria, such as Helicobacter pylori, responsible for gastric ulcers and other gastrointestinal issues, making ginger an effective tool for promoting healthy digestion and preventing complications. 4. Immune system support. Ginger is a powerhouse of antioxidants and bioactive compounds that strengthen the immune system. It contains gingerol, shogal, and zingerone, which have antimicrobial, antifungal, and antiviral properties. These components not only protect the body against infections but also stimulate the production of white blood cells, the body's defense cells. During an infection, such as a common cold or flu, ginger can act directly to fight the infectious agent while reducing associated inflammation, speeding up recovery. Regular consumption of ginger can also help prevent the onset of current respiratory diseases like bronchitis and sinusitis by strengthening the body's natural defenses. It also helps reduce fever by promoting sweating, which in turn lowers body temperature. Additionally, ginger's antioxidant action prevents oxidative stress in immune cells, improving their function and response to invaders. 5. Menstrual pain relief. Ginger has been traditionally used by women in various cultures to relieve menstrual pain, or dysmenorrhea. Menstrual pain occurs when the uterus contracts intensely to expel the uterine lining, a process stimulated by prostaglandins, hormone-like substances also involved in inflammation. Ginger acts as a natural inhibitor of prostaglandins, similar to the mechanism of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. By reducing the production of prostaglandins, ginger decreases uterine contractions and, consequently, pain. A study demonstrated that consuming ginger during the first days of the menstrual cycle was as effective as conventional pain relievers, without side effects like stomach pain or nausea. Additionally, ginger may help regulate the menstrual cycle in women suffering from hormonal imbalances, alleviating not only pain but also symptoms such as bloating and mood swings. 6. Blood sugar control. Ginger has shown promising potential in regulating blood sugar levels, particularly in people with type 2 diabetes. Gingerol, found in ginger, improves glucose uptake by muscle cells without the need for additional insulin. This means that ginger can help lower blood sugar levels and improve insulin sensitivity. Insulin resistance, one of the main causes of type 2 diabetes, occurs when the body's cells do not respond properly to insulin, resulting in elevated blood sugar levels. Ginger helps restore normal cell function by increasing their ability to absorb glucose. Clinical studies indicate that consuming 2 grams of ginger per day can significantly reduce fasting blood sugar levels and improve lipid profiles in diabetics. This makes ginger a natural alternative to complement traditional diabetes treatment, helping prevent complications such as nerve damage, kidney problems, and heart disease. 7. Cholesterol reduction. High levels of LDL cholesterol, bad cholesterol, are associated with the risk of cardiovascular diseases, such as atherosclerosis, heart attack, and stroke. Ginger can help reduce cholesterol levels by directly influencing lipid metabolism in the liver. It increases the conversion of cholesterol into bile acids, which are excreted by the body, thereby lowering circulating LDL cholesterol levels. Ginger can also inhibit cholesterol reabsorption in the intestine, helping to prevent the buildup of fatty plaques in the arteries. Additionally, it improves HDL cholesterol, good cholesterol, levels, which remove excess cholesterol from the arteries and transport it back to the liver for excretion. Studies show that regular ginger consumption can reduce total cholesterol and triglyceride levels in the blood, promoting more robust cardiovascular health and preventing the hardening and narrowing of arteries. 8. Improves blood circulation. Ginger's ability to improve blood circulation is directly related to its vasodilatory action, which helps expand blood vessels and facilitates the flow of blood throughout the body. Poor circulation can lead to various problems, such as varicose veins, cold hands and feet, muscle cramps, and even high blood pressure. Ginger acts as a natural anticoagulant, preventing platelet aggregation, which can result in the formation of harmful blood clots. It also enhances the circulation of nutrients and oxygen, which is vital for the health of tissues and organs, especially the heart and brain. People with vascular diseases or those at risk of thrombosis can benefit from ginger, as it helps keep the blood more fluid and prevents artery blockages. Moreover, by improving circulation, ginger can also alleviate muscle pain, cramps, and improve athletic performance. 9. Antioxidant properties. Ginger contains high levels of antioxidants, which combat free radicals, unstable molecules that can damage cells and promote premature aging and the development of chronic diseases. Oxidative stress, caused by an imbalance between free radical production and the body's ability to neutralize them, can lead to conditions like cancer, Alzheimer's, heart disease, and diabetes. The antioxidant compounds in ginger, such as gingerol, shogal, and peridol, neutralize these free radicals and prevent them from causing damage to cells and DNA. Regular consumption of ginger can not only slow down cellular aging but also protect against tissue and organ degeneration, increasing longevity. 10. Anti-cancer action. Research indicates that ginger contains compounds with anti-cancer properties that may play a significant role in cancer prevention and treatment. Bioactive compounds such as gingerol and shogal have shown the ability to inhibit the growth of cancer cells and prevent their spread. Laboratory studies suggest that ginger may be effective against several types of cancer, including colon, breast, prostate, and pancreatic cancers. One of the ways ginger works is through apoptosis, a self-destruction process that eliminates defective or harmful cells from the body. Ginger stimulates this mechanism, inducing cancer cells to self-destruct without affecting the surrounding healthy cells. Additionally, it inhibits angiogenesis, the process by which new blood vessels form to nourish tumors, thereby hindering their growth and development. While ginger does not replace traditional treatments like chemotherapy or radiation therapy, its regular consumption may enhance therapeutic effects and prevent the development of cancerous cells in the early stages. 11. Brain function improvement. As we age, a gradual decline in cognitive function is natural, but ginger can help preserve brain health and combat neurodegenerative diseases like Alzheimer's and Parkinson's. Oxidative stress and chronic inflammation are two factors that contribute to brain aging and cognitive dysfunction. Ginger, rich in antioxidants, fights oxidative stress in brain cells and protects neurons from damage caused by free radicals. Moreover, ginger may increase levels of essential neurotransmitters like dopamine and serotonin, which are crucial for memory, learning, and emotional well-being. Studies suggest that regular ginger consumption can improve short-term memory and cognitive function in middle-aged and elderly adults, as well as slow the progression of neurodegenerative diseases. Additionally, ginger's anti-inflammatory properties help reduce neuroinflammation, a process associated with diseases like Alzheimer's. This makes ginger a natural option for preserving brain health throughout life. 12. Support in weight loss. Ginger is one of the most studied plants in the context of weight loss due to its ability to influence metabolism and promote fat burning. The process of thermogenesis, by which the body increases heat production and therefore burns more calories, is one of the mechanisms through which ginger aids in weight loss. This thermogenic effect can slightly increase the basal metabolic rate, meaning the body burns more calories at rest. Additionally, ginger contains compounds that help control appetite, reducing calorie intake and preventing sudden hunger spikes. Another important benefit of ginger is its ability to improve insulin sensitivity and regulate blood sugar levels, which are crucial factors for weight control, especially in people with metabolic syndrome or insulin resistance. By preventing blood sugar spikes, ginger also helps avoid fat accumulation, particularly in the abdominal area, which is associated with a higher risk of metabolic and cardiovascular diseases. 13. Analgesic effect. Ginger has potent analgesic properties, making it an effective alternative for relieving different types of pain without the side effects associated with conventional medications. Its effect is comparable to non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and acetaminophen, as ginger inhibits the production of inflammatory chemicals like prostaglandins, which are responsible for pain perception. Ginger consumption can be beneficial for people suffering from muscle pain after intense physical activities, as it speeds recovery by reducing inflammation in damaged tissues. Ginger is also effective in relieving joint pain, such as that associated with rheumatoid arthritis and osteoarthritis, improving mobility and reducing morning stiffness in the joints. For headaches and migraines, ginger works by dilating blood vessels, improving blood flow, and reducing the intensity of attacks. Due to its natural and safe profile, ginger is a recommended option for treating both chronic and acute pain of various origins. 14. Reduction of oxidative stress. Oxidative stress occurs when there is an imbalance between the production of free radicals in the body and the ability of antioxidants to neutralize them. This can lead to premature aging, cellular damage, and eventually the development of chronic diseases such as cancer, heart disease, and diabetes. Ginger is rich in antioxidant compounds, such as gingerol and shogal, which directly combat free radicals, preventing them from damaging cells. These antioxidants not only help protect the cells of vital tissues, like the heart and brain, but also promote cellular regeneration. By reducing oxidative stress, ginger supports normal organ function and improves immune response, preventing the onset of aging-related diseases. In the long term, regular ginger consumption can help preserve cellular youth, slow down the signs of aging, and maintain overall health. 15. Improves digestive health. Ginger is one of the best natural allies for digestive health due to its ability to act on several fronts. It stimulates the secretion of digestive enzymes, such as lipase and protease, which are essential for the digestion of fats and proteins. This ensures that nutrients are properly broken down and absorbed by the body. Additionally, ginger relaxes the muscles of the gastrointestinal tract, facilitating food movement and preventing common discomforts like gas, bloating, and cramps. Its soothing effect on the digestive system also makes it effective in treating more severe conditions, such as irritable bowel syndrome, IBS, and gastroesophageal reflux disease, GERD, where the digestive tract becomes irritated and overactive. Ginger also helps prevent the formation of stomach ulcers by protecting the stomach lining from corrosive and acidic substances. Regular consumption not only improves digestion but also contributes to maintaining a healthy and balanced digestive system, preventing long-term problems. Although ginger offers numerous health benefits, its use may be contraindicated for certain individuals due to interactions with medications or specific health conditions. Here are the main groups of people for whom ginger consumption should be avoided or approached with caution. 1. People with bleeding disorders. Ginger has natural blood-thinning properties, which means it can prevent blood clots. While this may be beneficial for many individuals with bleeding disorders, such as hemophilia, or those already taking anticoagulant medications, such as warfarin, aspirin, or clopidogrel, may be at increased risk of bleeding and bruising. In these cases, ginger can amplify the effects of anticoagulants, making the blood even thinner, potentially leading to complications like internal bleeding or uncontrolled bleeding. 2. Pregnant women, in the third trimester. Although ginger is often recommended to relieve nausea and vomiting during the early months of pregnancy, consuming large amounts during late pregnancy can be risky. Some studies suggest that ginger may increase the risk of bleeding during labor due to its anticoagulant properties and, in rare cases, may stimulate uterine contractions, raising the risk of premature labor. Pregnant women should consult their doctor before consuming ginger, especially during the third trimester. 3. People with low blood pressure. Ginger has the ability to lower blood pressure as it improves blood circulation and relaxes blood vessels. For individuals with naturally low blood pressure or those already on hypertension medications, ginger may exacerbate these effects, leading to dangerously low blood pressure, which can cause dizziness, weakness, fainting, or, in extreme cases, circulatory shock. People with low blood pressure should consume ginger in moderation and under medical supervision. 4. People with gallstones. Ginger can increase bile production, which, in some cases, aids in fat digestion. However, for individuals with gallstones, cholelithiasis, increased bile production may worsen the condition, triggering pain and complications. Ginger may stimulate the gallbladder to contract, which can worsen symptoms for those with existing gallstones, leading to episodes of biliary colic. 5. Diabetics taking hypoglycemic medications. While ginger can help reduce blood sugar levels, its consumption may pose a problem for diabetics already taking medications to control glucose, such as insulin or other hypoglycemics. Ginger can enhance the effect of these medications, potentially causing excessive drops in blood sugar levels, hypoglycemia. This can result in symptoms like dizziness, confusion, fainting, and, in severe cases, seizures or coma. Diabetics should closely monitor their glucose levels if consuming ginger regularly and consult their doctor to adjust medication dosages if necessary. 6. People with severe gastrointestinal issues. Although ginger is generally beneficial for digestion, it can cause irritation in individuals with severe gastrointestinal conditions such as advanced gastric ulcers, Crohn's disease, or ulcerative colitis. In excessive amounts, ginger may increase stomach acid production, worsening symptoms like heartburn, abdominal pain, and acid reflux. People with these conditions should avoid consuming large amounts of ginger to prevent aggravation of their symptoms. 7. People allergic to ginger. Although rare, some individuals may have a sensitivity or allergy to ginger. Symptoms of a ginger allergy may include rashes, itching, swelling, particularly of the face, tongue, and throat, difficulty breathing, and, in severe cases, anaphylactic shock. Those with a history of allergic reactions to other foods should be cautious and monitor for any adverse reactions when consuming ginger, consulting a doctor if symptoms occur. 8. People in preoperative care. Due to its blood-thinning properties, ginger is contraindicated for people about to undergo surgery. Ginger can increase the risk of bleeding during and after surgical procedures. It is generally recommended to stop consuming ginger at least 2 weeks before any scheduled surgery to minimize the risk of hemorrhagic complications during the procedure. While ginger is a widely beneficial medicinal food, these contraindications highlight the need for caution in certain circumstances. It is always advisable for individuals, especially those with pre-existing health conditions or who are taking medications, to consult a doctor or nutritionist before incorporating large amounts of ginger into their diet. Ginger is a versatile ingredient that can be used in various ways for both culinary and health purposes. Here are some creative and practical ways to incorporate ginger into your diet. 1. Ginger tea. One of the most popular ways to consume ginger is through tea. To prepare, slice or grate a piece of fresh ginger and add it to hot water. Let it steep for about 10 minutes. You can add lemon and honey to enhance the flavor and boost the benefits. 2. Ginger juice. Add fresh ginger to your favorite juice. Simply grate or crush a piece of ginger and mix it with fruit or vegetable juice, such as apple, carrot, or lemon. This not only adds a spicy kick but also enhances the health benefits. 3. Smoothies. Incorporate ginger into smoothies for a refreshing and spicy taste. Combine fresh ginger with fruits like pineapple, banana, and spinach, along with yogurt or almond milk for a nutritious smoothie. 4. Seasonings and condiments. Ginger can be used as a seasoning in various recipes. Grate or chop fresh ginger to add to marinades, sauces, soups, and stews. It pairs well with meat, chicken, fish, and vegetable dishes. 5. Candied ginger. Candied ginger is a delicious way to consume ginger. It can be used in desserts such as cakes, cookies, or granola. It's also a great option for snacks and can be added to trail mixes. 6. Asian cuisine. Ginger is a key ingredient in many Asian recipes, such as stir-fries, curry, and soups. Try adding fresh or powdered ginger to dishes like teriyaki chicken or miso soup. 7. Herbal infusions. Combine ginger with other herbs, like mint, basil, or rosemary, to make aromatic infusions. This can be done with hot water, like tea, or in cold beverages. 8. Ground ginger. Ground ginger is great for use in baked goods like bread, cakes, and cookies. It can also be added to oatmeal, smoothies, or protein shakes. 9. Ginger oil. Ginger essential oil can be used in aromatherapy or for massages. However, always dilute it in a carrier oil before applying it to the skin. This method helps relieve muscle pain and promotes relaxation. 10. Ginger compress. To relieve muscle or joint pain, you can prepare a hot ginger compress. Boil fresh ginger in water, soak a cloth in the solution, and apply it to the affected area. This provides relief through heat and ginger's anti-inflammatory properties. 11. Pickled ginger. Pickled ginger is delicious and can be used as a side for Japanese dishes like sushi or to add a sweet and sour touch to salads and various dishes. 12. Sweets and desserts. Ginger can be incorporated into various desserts, such as puddings, mousses, pies, and cakes. The spicy flavor of ginger pairs well with sweetness, bringing an interesting balance to dishes. 13. Ginger broth. For a comforting broth, boil pieces of ginger with onions, garlic, and vegetables. This creates a flavorful base that can be used for soups or risottos. 14. Salads. Add grated or cubed fresh ginger to your salads. It pairs well with crunchy vegetables and adds a refreshing, spicy kick, especially in Asian-style salads with soy sauce dressing. 15. Marinades. Use fresh or powdered ginger in marinades for meats and tofu. Mix with soy sauce, garlic, and lemon to create a flavorful and aromatic marinade that penetrates well into the food. Here are some studies highlighting the health benefits of ginger, focusing on various areas. 1. Anti-inflammatory and analgesic properties. A study published in the Journal of Pain, 2010, investigated the effects of ginger on patients with osteoarthritis. Researchers found that daily consumption of ginger significantly reduced pain and improved joint function in participants, suggesting that ginger may be a natural option for pain management in inflammatory conditions. 2. Nausea control. A review of studies published in the Journal of Alternative and Complementary Medicine, 2012, analyzed the use of ginger for treating nausea and vomiting, especially during pregnancy and chemotherapy. The results showed that ginger is effective in reducing nausea, with doses of 1 to 1.5 grams per day being the most recommended. 3. Antioxidant effects. A study in the Journal of Agricultural and Food Chemistry, 2005, identified that the antioxidant compounds in ginger, such as gingerol, have the ability to neutralize free radicals and reduce oxidative stress in the body. This can help protect against chronic diseases like cancer and heart disease. 4. Blood glucose reduction. Research published in the Iranian Journal of Pharmaceutical Research, 2013, investigated the effects of ginger in individuals with type 2 diabetes. The study found that consuming 2 grams of ginger powder per day resulted in a significant reduction in blood glucose levels and improved lipid profiles, demonstrating its potential as an anti-diabetic agent. 5. Anti-cancer effects. A study in the journal Cancer Prevention Research, 2012, evaluated the effects of gingerol on colon cancer cells. The results showed that gingerol induced cell death in cancer cells and prevented their proliferation, suggesting that ginger may have preventive properties against cancer. 6. Cardiovascular health. Research published in the American Journal of Cardiology, 2015, analyzed the relationship between ginger consumption and cardiovascular health. The study indicated that ginger can reduce LDL cholesterol and triglyceride levels, as well as improve endothelial function, which is beneficial for heart health. 7. Improvement in digestion. A study in the World Journal of Gastroenterology, 2011, showed that ginger can accelerate gastric emptying in patients with functional dyspepsia. This suggests that ginger may help alleviate digestive discomforts such as bloating and abdominal pain. 8. Brain health. Research published in Nutritional Neuroscience, 2012, examined the effects of ginger on cognitive function in older adults. The results showed that ginger consumption may improve memory and attention capacity, possibly due to its antioxidant and anti-inflammatory properties. 9. Effect on anxiety and stress. A study published in Phytotherapy Research, 2019, investigated the impact of ginger in animal models of stress. Researchers found that ginger reduced stress-related behaviors and improved anxiety markers, suggesting it may have a calming and anxiolytic effect. Now that you know about the incredible benefits of ginger, it's clear that this powerful root can be a great ally for your health, right? Whether to improve digestion, relieve pain, or strengthen the immune system, ginger offers a range of advantages worth incorporating into your daily routine. So, why not start enjoying these benefits today? If you liked the content, don't forget to like the video, subscribe to the channel, and share it with anyone else who could benefit from ginger. See you next time.